Good morning, everyone. We'll start with the new topic, Health Management Information System, or shortly MIS, or Management Information System. What's the definition? Health Information System is that the system in which collection, utilization, analysis, and transmission of information is done for conducting health services, training, and research. Okay? In the health services, training, and research, if we use the technology and the usage of the system to collect, utilize, and analyze and transmit the information is called the health information system. So what are the objectives of MIS? To provide reliable, latest, and useful health information to all levels of health officers and administrators. Okay, main here is giving the information or modern technology or modern information. Okay. To amend health policies and working system on the basis of feedback received from health information system. Okay. Policy can be changed and working system can be changed, or some modification can be done based on the feedback received through the health information system. To provide information about periodically and time-bound programs and for midterm evaluation. Okay. Periodically, if we want to evaluate something or to give information or to conduct any programs and to do midterm evaluation, we can use this MIS. To contribute towards achievement of objectives of health policies and programs. Every health policies and programs have certain aims and objectives. So to achieve that, we need this MIS. To increase efficiency and quality in health management. And the characteristics are, according to WHO, the information should be problem oriented. Information should be population based. Functional and directorial wording should be used. Information should be expressed in short and in imaginative form by using graphs, chart, or table. Okay? In the MIS, whatever MIS you are doing or the information you are giving, it should be problem oriented. It should not be any general topic, and it should be including the population or population based problems and information, and functional and directorial wording. That means from the management, the wording should be given. Okay? Whatever information you are giving, the title or anything. And whatever information is there, you should give or express in the graph, chart, or table. Facility for data feedback must be present in health information system. Okay? It should be presented through the health information system itself. And latest technology should be used in health information system. Unnecessary figures or data should not be present in information system. Okay? It should be limited and well usage of the data or technology should be done. For information management, organizational structure must be present. Okay? When you give this information in the structural form or organized manner itself, you should give this information. Domains or fields of health information system. It includes demography, vital statistics, health system input, output, health determinants, health economics, health status, health infrastructure, resources and outcome, financial statistics, environmental health statistics. So see, this everything here data analysis comes, statistics comes, and modern technology usage will come in this, and you will analyze whatever data is there and you will mention it, or you will present it through the graphs or chart. In the demography also, even in the vital statistics also. So these are the domains which come under the health information system. How the process occurs? You will collect the data. Okay, that is data collection. You will transmit the data. That is data transmission. Then you will process it in the system and you will analyze and information for use in the plan and the management. Whatever information you got after the analysis, you will use this in the planning and the management in the hospital. Okay? And this will have the organization rules which given by the management by seeing the resources of the information process. Okay, whatever resources you have used to collect the data from that resources will be coming under the management, and they will be having certain organization rules, and based on the rules you can use the plan, whatever analysis you got from the information process. What are the sources of health management information system? First is census. Every 10 years or annually there will be census. From there you can get the sources or the information. Registration of vital event like birth, death, marriage, etc. Notification of disease and disease registers. Records and reports of hospitals. Statistics regarding environmental health, and statistics regarding the health resources and services. So these are the main sources of MIS or HMIS. And it continues with the sample survey by the National Sample Survey Organization, okay, conducted by the Survey of India. Population survey, statistics regarding efforts to check epidemiological disease and researches in this field. Okay. Certain statisticians are there, they will conduct the statistics of the epidemiological diseases, and they will conduct some certain researches. And from the school record, economic planning and plans of social security. From these are the main sources of HMIS. And what are the problems or constraints of HMIS in India? Okay, first one is structural problems like multiplicity of institutions and departments, fragmentation of data, lack of infrastructure facilities for storage and the maintenance of records. See, first one is structural. You do not have particular institution or the organization to conduct this survey or to do this MIS, and data fragmentation will be there. Okay? It is split up. All the data are split up, and particular facility is not there to store and maintain the record. And the procedural problems, excessive information because of more population, encryption or hidden issues are more, exhaustive information and seldom used, overburden of collection and recording of data along with general health care, incomplete, unreliable and intentionally managed system. Okay, information. The procedure means it's during the collection of data or during the procedure or the analysis. These are the problem you will see. How you will collect the information, how it will be encrypted, and whether it is more or less, and how you will collect, whether it is complete or incomplete, like this. Okay, these are the procedural problems. And it continues with repetition of general information because of more population. Sometimes there will be a repetition of general information. Inappropriate forms, cards, and reports will be used in collection of data. Less interest of users in information. Time-consuming procedure. Confusing coding, long list of indices, and absence of feedback to information supplier. Okay, these are the another problems and the procedure itself. It is very time-consuming, and sometimes we will use the wrong cards or the reports, and the coding is very difficult here, and the feedback will not be present sometimes. And based on the related to consent, there are problems like mostly service utilization statistics, only summarized information reaches at higher level, less emphasis on socioeconomic information, and no user friendly. Mostly service utilization statistics means who are in the work or who are well educated. Based on them, certain statistics will be taken, and only summary will be sent to the higher level. Okay, whole process or the entire information will not be sent, only the summary at last what result you got, only that information will be sent to the higher level. Okay, and based on the socio-economic information there is less data and it is not user friendly. And related to human resource, absence or lack of skilled medical record professionals. Okay, medical record professionals are very less. A lack of opportunity for in-service training for the staff, in-service education. That means when the people or the professionals are in the job, if they are getting any education, that is called in-service education. If they are lacking with that, then it is very difficult in this. Healthcare providers, nurse, biomedical trained personnel are collecting and preparing the data. Okay, there are no the separate professionals to conduct this MIS, and lack of motivation or extra incentives. There is no motivation to do, or very less the salary or something like that. And technological problems, much manual paper-based system, absence or lack of computerized data-based system. Okay, it is manual made. All the MIS, most of the time it is manual, less usage of computer, and computerized data is very less or it is absent. So what are the subsystem or subcomponents of HMIS? Epidemiological surveillance, routine service reporting, specific program reporting, administrative system, and vital registration. So these are the subsystem coming under the HMIS. Okay? Surveillance means it's a survey in the epidemiological diseases or certain condition, and routine service reporting, and a specific program regarding that if you are giving reports, and administration related reports, and vital registration. For everything there will be vital status or the data, and that data also coming under, or that system also coming under this HMIS. What are the challenges for HMIS? Low level of public will about vital registration system. Okay, we should improve that public with, or we should give information about this to the public so that they will willingly come and register in this. Inadequate government's capacity and lack of firm political decision. Okay, so the political decision is very less. Political parties are not invading in this HMIS, and they are not coming and taking certain decisions regarding HMIS. Gender issues in vital event registration, fragmentation of health information, establishing a unified information system in country. Okay? Unified information system is very difficult to establish in the country, and fragmentation of health information, that means the dividing of health information. This is also certain challenges under HMIS. What are the benefits? Helping decision makers to detect and control emerging and endemic health problems. Okay, if we have the data, or if we know before itself what are the problems, we can predict what will be the problem, okay, in the future. So that is very helpful in we can prepare for this crisis. Help in monitoring progress towards health goals and promote equity. Okay, we can promote into the health goals. Empowering individuals and communities with timely and understandable health-related information. Empowering individuals means we are training the people for this health-related information, and improving quality of services. Strengthening the evidence base for effective health policies. Evidence-based practice should be practiced here. Permitting valuation of scale-up efforts and enabling innovative through research. Okay, innovation should be started in the health field, and certain new technology can be brought up. Mobilization new resources and ensuring accountability in the way they are used. Okay. New resources can be mobilized, and how they are used and who are using, they are responsible for any damage to it. And improving the governance. Administration to be improved in this manner. So what is NIMS? That is Nursing Information System. We have seen Health Information System or Health Management Information System. Under that, what is Nursing Information System? They are computer systems that manage clinical data from a variety of healthcare environments and made available in a timely and orderly fashion to aid nurses in improving patient care. Okay, this is data we are secured in the computer, and we can use whenever we want. What are the applications? Workload measurement and staffing requirement can be seen. Personal management, how they are done, and the staff scheduling, and fiscal resource management. This everything can be done by using the NMIS. So these are the applications. What is fiscal resource management? The information generated can be used to monitor past performance or to predict future performance. Okay, past how it is done and future how can be done. This can be predicted by using fiscal resource management. Accumulated data can be analyzed for the development of trends that can be used to project future expenditure. Okay, new technology can be brought up, and we can use the accumulated data to improve the care. And necessary reallocation and budgetary adjustment can then be made on the basis of these projections. Okay, we will know how the future technology will be, how the future care will be, and based on that we can do a budget. And workload measurement and staffing requirement. It helps to store, manipulate, and retrieve large volume of data. The information generated assists nursing managers in planning, monitoring, and evaluating use of nursing resources on a daily basis and in the longer time frame. It is used to generate staff schedules with conjunction with personal management. Workload measurement means how the nurses are working and how much, which field can be given to them, and whether they are working on time or not, and how whether this much staff is enough or we need more or not. See, these are the information we will get from this NIS. So this is very important here. And staff scheduling, nursing managers are able to plan schedules in advance with considerable time saving. Staffs are informed well ahead of time, like register we are maintaining, even in the computer or timetable can be managed. And the personal management, an employee with a special mix of skill can be located. Records are readily accessible, needed for accreditation purposes or to monitor contract compliance. The information may be retrieved on a daily basis for use in conjunction with workload measurement and contract requirement to plan staffing assignment. Personal management is how one person is working, what are their skills, and whether they are doing this work properly, and how the data are processed and how it is recorded, and how the workload can be measured, how it is managed, staffs are enough or not. So these are the personal management. Everything can be got from this NIS, which are stored in the computer. So what are the advantages of NIS? It is very useful in the nursing administration to evaluate quality assurance program, to defend resource allocation to nursing, to demonstrate the contribution nursing makes to the care of the patient, and identify outcomes of the nursing care. And in the nursing practice, it enhances the documentation by nurses. The documentation, recording and reporting is very important. Provide data to enable research directed at examining the interrelationship between data elements and nursing outcomes. Related the interpersonal relationship and the nursing outcome, we will get the data from this, and facilitate development of the nursing process. In the nursing research, to assess variable on multi-levels including institutional, local, regional, and national. Okay, variables can be measured in this or assessed, and identify trends to build information and to further synthesize to develop nursing knowledge. Nursing knowledge and information can be built by using this NIS. And in the nursing education, to develop body of knowledge with focus on nursing process, to enable staff education needs based on the follow-up, care, and outcomes, to enhance student nurses accurate documentation. Here also it is very important for the documentation itself and for the certain educational needs. So that's all about the MIS, HMIS, and NIS. We'll see in the next chapter. Thank you.